Countless women suffer silently. Women endure chronic pain, prolonged bleeding, fertility challenges, and emotional strain, often without answers or support. We're talking about fibroids, one of the most common yet under-discussed health condition affecting women. For some, fibroids are mild inconvenience, but for many, they are a life-altering condition that disrupts work, family life, relationship, self-esteem, leaving them feeling unheard or misunderstood. Now, during this discussion, we intend to attempt to change that silence into knowledge and the struggle into hope. Our topic of discussion right now is the silent struggle, understanding fibroid and the future of non-invasive treatment. We have a guest that we are honored to have this morning. He is a leading voice in women's reproductive health, an advocate for women's wellness, and a pioneer in alternative treatments such as high-intensity focused ultrasound, known as HIFU. I'm not going to unveil him now. Let's see what his profile frame looks like. Know that it will be in a good place to say our guest right now is someone we can say is a he for she. If he spends all his life taking care of women and making researches on a daily basis to better the health of women. Welcome, Dr. Abayomi Ajayi.
Thank you so much, Whitey.
You're welcome.
For me, my pleasure. It's great to be here.
Honestly, we are honored to have you. I have a lot of, when I was going through this, I have a lot of questions in my head, but limited time. So, I'm going to appeal to you to help us make your responses, because we have a lot to ask you.
Because we are women.
Because we are women, and we, somehow we know one woman or the other, connected to one woman or the other, going through this, and a lot of women out there not even talking about it, and dying. Unfortunately, we even lost a social media influencer, Big Bot, during the week, and it was said that she had to go for fibroid operation, as was Abayomi was really big, and she endured a lot of cyberbullying and a lot of so much of that. We have women, 1,000,001 women out there. So let's start from here. Let's talk about fibroids.
Yeah.
How do I know that? At least when I have headache, I have cold, I have, I know that probably I have malaria. So how do I know that, could this be fibroid? Please tell us.
Thank you so much. That's one of the problems with fibroids, because about 50% of women who have fibroids have no symptoms at all.
Oh my God.
So because it's a slow-growing tumor, it is not a cancer. So let's start with that. But it's the commonest growing tumor in reproductive tract of women in their reproductive age. Up to, there are always estimates. We say about 33 to 77% of women all over the world have fibroids. But when it comes to black women, then we say we have 70 to 80% lifetime risk of having fibroids before you're 50. Now back to the symptoms. Like I said that.
So if I'm 50 and above?
Well, most of no, because you will have stopped menstruating. So, and then even if you have fibroids, it's not likely to continue to grow. So, if you don't have it at that point in time, you are very unlikely to have fibroids. Okay. So now the symptoms, like I said, 50% no symptoms at all. But for those who have symptoms, the commonest problem is with their menstrual cycle. Either it becomes heavier, or it becomes prolonged. So somebody bleeding for 3 days before now becomes 5 days, 7 days, for some 2 weeks. And then they can bleed irregularly. And some can have pain. They just have pain, sometimes only during their menstrual period, but sometimes all the time. The commonest thing that they all have is that there will be a growth below the belly button, or sometimes even extends above the belly button. So then, as this fibroid grows bigger, it tends to affect these organs that are surrounding the uterus. So the bladder, it could cause that you are frequently urinating, and sometimes you can't even urinate at all. It stops, and I had somebody like that over the week. Or sometimes it can press on your rectum, so you have constipation, and then also it can affect your kidneys when there's a backflow, so that it could lead to renal failure sometimes. And then the commonest reason why women present in the hospital is because of they can't have children. So most of the time when we see women, some of them have already known that they have fibroids, but they are not doing anything about it until when they get married and they cannot have kids. And then the fibroid is to blame for this. But sometimes it's not the fibroid that is the cause. But that gives us the opportunity to see majority of the women who have fibroids.
But is it life-threatening? Other than, all the side effects?
It could be life-threatening because there's some women who actually bleed to death. Okay, so I've had women these are educated women, who had fibroids, and they were managing it, as it were, and then they go somewhere and then they suddenly slump and they faint, collapse, and then they get to the hospital. So imagine that happens in a village setting where there is no hospital around or something. So some people die from it because it leads to shortage of blood.
Okay, when I was reading up, about the show today, something came into my head that probably the woman with the issue of blood had fibroids.
Oh no, but that's the joke. That's the joke among gynecologists.
Oh.
That the woman probably had either endometriosis or fibroids.
But now you talked about even educated women. Why is it that, as pronounced as it is, you've dealt with a lot of women, the elites, the middle class, the down, and all of that. Why do you think that, despite how common this is, you said among black women about 70% thereabout, why is it that we still have so much silence, so much stigma? Why? Why is it that women don't talk about it, don't seek for help, seek for assistance, and all of that? Okay,
maybe two things. You mentioned the first one, stigma. For whatever reasons, women are ashamed to talk about their menstrual period. And I tell them that, look, as a gynecologist, the problem is not when you see your menses, when you don't see it, there is a problem. So the first thing is that we have to empower women to be able to talk about their menses. I mean, sometimes I hear some women say, I was embarrassed. And I say, what? What were you embarrassed about? Oh, my menses just came unexpectedly and I was in a public place and then I wet myself. Okay, yes, it can happen once in a while, maybe. But we know that you menstruate, don't we? So I think women also need to get to that level of understanding that this is normal. Okay. Yes, we don't want to blood stain anywhere, but it's normal. It happens. Okay. Now, the second thing is that the fact that before now, the only solution to fibroids is surgery. And I'm sure nobody wants to be, it's never anybody's first option to want to be cut open. So those are some of the things that made talking about fibroids. And then, of course, again, it was also like associated with infertility. So no woman wants to say, especially if you are not married, you want to say you have fibroids, your market value will reduce.
Oh my God. Okay, so you've talked about, surgery and all of that. Now let's talk about the non-invasive treatment, which you are, will I say, preaching about now, which you say is a better option. Tell us about it. Educate women, our viewers about
Fantastic. That's why what we're trying to do now is that one of the reasons why fibroids get so big in this environment is because of the fear of surgery. So we have introduced a method that you don't need to be cut. And now, where we get it wrong sometimes, don't forget that as long as your uterus, if you have fibroids, as long as your uterus is still there, you can develop new fibroids. Whether you do surgery, whether you do HIFU, whether you do anything, you can develop new fibroids. And so, but one thing now is that we have a method that is as simple as you lying on the table for about 2 hours and then you get up, no cutting, no anesthesia, no blood transfusion, nothing. It's like and that same day you are discharged, you can start eating from that evening. From the next day, you can almost do anything. You can return if you do it on Friday, you can return to work on Monday. So what we're saying in essence is that women should also sometimes, because we're seeing fibroids in young girls. So in your mind, sometimes you must be prepared that, look, you have a method now that you don't have to wait until the fibroid becomes so big before you treat. You can treat, maybe let's say it's detected when you are 18. New ones come when you are 22, you can treat again, and it's not going to affect your ability to have children because it's ultrasound. Okay, so, and that is the selling point of what we have now. Some people, by the time they're going to have kids, they've had about 3 surgeries. And now for fibroids, when you have had about 3 surgeries, there is nobody can guarantee that you will not have scarring, which might also lead you to not having children. Either the scars are in the abdomen or they are even in the uterus, which makes it worse. So some people, because of the fibroids they have, will not be able to have children again because of the surgery that they've had because of scarring. So, but apart from that also, we're taking away some of the risk and aesthetic problems. We're taking away the blood transfusion risk because anybody who has blood transfusion, of course, there are risks that are unknown sometimes. And then we're taking away all the complications that come from scarring, the ones that come from you developing blood clots in your system that can kill. So and then the chance of recurrence also is lower. So these are the things that we're offering with this non-invasive method of treatment.
I wanted to say that for some of us, when we just hear fibroids, it's like, something is happening in our head, like you're not going, it's sending a sensation like we may not come out of it. So now, and I don't know if this is a fact or a myth, I heard that if you have your children early, you might not have the risk of having fibroids.
True.
Not too true. Okay, so now, what can we do? Is there a way that we can totally not have it? Maybe something that we can do with lifestyle and all of that.
That might be tough because the greatest risk factor for fibroids is in your genes.
Oh, okay.
That is why the greatest risk factor is that if a family member, your mother or your sister has fibroids, because it's in your genes, it's inherited.
Okay.
Now, but your lifestyle can modify the risk factors, but it cannot totally take it off. What we think might be able to take it off is when we have more research, and that's why July is Fibroid Awareness Month globally. When we have more research that we're able to identify the gene that is responsible for this transmission. Then, just like we're doing with sickle cell now, just like we're doing with some cancers now, you were talking about breast cancer. Now we can screen for some breast cancer, and actually we can do IVF and remove the embryos that have such the genes, and therefore transfer the ones that are free from the, that will probably be what we'll be able to do for fibroids in future.
Okay, our time is fast spent, but I'd like you, we know all the, we've heard all the, for the optimum time, the side effects of the normal surgery. This non-invasive treatment, HIFU, that you are brought in, into Nigeria, and you've done on several women. And
over 730.
Wow, and we hear testimonies, because I have heard testimonies of women about it. Does it have any form of side effects?
Yes, there's nothing that has no side effect in this world. So it can, but the thing is that that's where the training of the doctor comes in, because it's a non-invasive method. So the skin, there can be skin burns, but out of the 730 that we've done, we've not had any. So, but their potential risk, it could burn some, because ultrasound is being converted to heat energy, all right? So it's possible for the heat to dissipate to some other places. That's why when you are doing the procedure, you are not sleeping. You can talk to us. So when you, for example, you are going to lie in water, because the ultrasound travels better in water. So your tummy, you're going to lie on the table. It has some like water bath, and then so if the water is becoming so hot for you, you let us know. Once all the things are done according to, there is no complication at all. But if the doctor is not well trained, then it could become a tool can become a weapon.
Dr. Ajayi, we have to bring you back. We really have to bring you back, because my producer is saying we have to go. But finally, what would you say, maybe in 10 seconds, the future of fibroids treatment with this HIFU treatment that you have brought in Africa looks like?
Well, we think that's the future of fibroid treatment, because even in very enlightened and advanced countries, people still die from fibroid surgery. And people get very sick from fibroid surgery. So over time, we see that this, just like every other thing, non-invasive methods are becoming the in thing all over the world. So we see with fibroids over time also.
All right, thank you very much, Dr. Abayomi Ajayi. I'm sure we just, Fumi, what do you feel? We just have to bring you back.
Yes,
we just have to bring you back, and I hope you oblige us.
Anytime.
Thank you so much. Dr. Abayomi is the founder of Nordical Fertility Center in Lagos here and all over Nigeria. Thank you for being our guest. We've been talking about the non-invasive treatment of fibroid. Thank you so much, sir. All right, we'll go on a short break. When we return, our next guest will be in the studio with us. Don't go anywhere. We'll be right back.